Initial macroscopic examination of semen analysis. This is the container in which the semen sample is being taken. Semen analysis begins with a simple inspection soon after liquefaction, preferably at 30 minutes but no longer than 1 hour after ejaculation, to prevent dehydration or changes in temperature from affecting semen quality. Semen liquefaction. Immediately after ejaculation into the collection vessel, semen is typically a semi-solid coagulated mass. Within a few minutes at room temperature, the semen usually begins to liquefy. That means it becomes thinner, at which time a heterogeneous mixture of lumps will be seen in the fluid. As liquefaction continues, the semen becomes more homogeneous and quite watery, and in the final stages only small areas of coagulation remain. The complete sample usually liquefies within 15 minutes at room temperature, although rarely it may take up to 60 minutes or more. If complete liquefaction does not occur 60 minutes, this should be recorded. Normal liquefied semen samples may contain jelly-like granules, gelatinous bodies which do not liquefy. These do not appear to have any clinical significance. The presence of mucus strands, however, may interfere with semen analysis. Samples which do not liquefy need additional treatment such as exposure to bromelain to make the sample amenable to analysis. Semen viscosity. The most convenient way to determine viscosity is by means of a modified pipette method. The viscosity is regarded as normal when single drops are formed that are released within a distance of 20 mm from the point of the pipette. If threads are longer than 20 mm, the viscosity can be regarded as increased. It is also important to distinguish between a delayed period of liquefaction, non-homogeneous appearance, and an increase in the viscosity that is homogeneous but sticky. Increased viscosity may be the result of abnormal prostatic function due to an infection in the genital tract, prostate or seminal vesicle, or an artifact as a result of the use of an unsuitable type of plastic container. A constant increase in viscosity may be regarded as a cause of infertility for in vivo conception and can also have an adverse effects on the determination of spermatozoa concentration and motility. Appearance of the liquefied semen. A normal liquefied semen sample has a homogeneous gray opalescent appearance. It may appear less opaque if the sperm concentration is very low. The color may also be different, that is red-brown, when red blood cells are present. Hemospermia. Yellow is a man with a jaundice or taking certain vitamins or drugs. Semen volume. The normal volume of an ejaculate after 3 to 5 days of sexual abstinence is 2 to 6 ml. If the volume of the semen sample is smaller than 1 ml, it is important to establish whether a complete sample was collected. This is important as the first portion containing the major amount of sperm with the best motility is often lost. Semen pH. The pH is determined by acidic secretion of the prostate and alkaline secretions of the seminal vesicles. It should normally be in the range of 7.2 to 7.8. To test pH paper range is 6.1 to 10 is used. Whatever type of pH paper is used for this analysis, its accuracy should be checked against known standards before the use in routine semen analysis. The pH should be measured after liquefaction at a uniform time, preferably after 30 minutes, but in any case within 1 hour of ejaculation, since it is influenced by the loss of CO2 that occurs after production. If the pH exceeds 8.0, infection should be suspected with decreased secretion of acidic products by the prostate, such as citric acid. Abnormal pH may also be recorded in cases of incomplete ejaculation. Extremely acidic pH is found in cases of agenesis or occlusion of the seminal vesicles. If the pH is less than 7 in a semen sample with low volume and low sperm numbers, there may be ejaculatory duct obstruction or congenital bilateral absence of the vas deferens, a condition in which seminal vesicles are also poorly developed. Thank you. Please like, comment, and subscribe. And if you have any question, then you can ask your question in the comment box.